Hello, welcome to the podcast. This is Behavioral Brilliance. My name is Piper Merrill. I'm a pediatric nurse practitioner. I've been practicing for 30 years, basically been in pediatrics 30 years and practicing as a pediatric nurse practitioner for 20 years. So this will be a fun podcast today. I'm going to answer the top 10 questions that pediatricians and pediatric nurse practitioners get asked. So the first question is, how much milk should my baby be drinking? Well, I would say, that's going to really depend specifically on their age. So I'll just kind of give you an overview. Basically, a newborn, so I see them when they're 3 days old, which is so fun. So they're going to probably take an ounce to an ounce and a half up to 2 ounces for the first probably 2 to 3 weeks of their life and gradually increase that. So by 1 month, you can think maybe 3 to 4 ounces a day, 8 to 10 feedings a day. By 2 months, it's going to be 4 to 5 ounces with each feeding, and then they're going to feed 6 to 8 times a day. 4 months, 4 to 6 ounces during each feed, and then it'll be 6 to 8 feedings a day. And then between 6 months and 12 months, and this is going to vary between each child, right? And some days are going to vary. Just like with us, some days I eat a lot, some days I don't eat much. But in general, this is what they're going to be eating. It's about 7 to 8 ounces each feed and 4 to 6 feedings a day. So that's kind of from 0 to 1 years of how much milk should a child have. So one question I get from parents is, why does my baby not wake up to feed? And I would say that all depends on what age they're at. So by the time they're 6 months old, really, they should be able to sleep a good 8 hours, 7 to 8 hours, to where they're not waking up in the middle of the night. Now, we'll go back to the newborn who is just, 3 to 5 days old. They're going to sleep a lot. And until they get 2 weeks old, I will have parents wake them up to feed every 2 hours until they get back to their birth weight at 2 weeks. So once they reach their birth weight, then I don't necessarily wake them up every 2 hours, but then you can go 3 to 4 hours. So a baby initially is going to sleep a lot, and you do have to just wake them up to feed them. But once they're back to their weight, and many times, like I said, waking a child up to feed or a baby up to feed is going to be based on where their weight is. Are they growing? They're healthy. They're doing well. Then we're not necessarily going to wake them up every 3 to 4 hours. But if they're a preemie or if they're small for their age, then we may want to feed them more frequently. So there again, we're all individuals, right? Babies are all individuals. So we're going to base it on the health of that child, where their weight is. But primarily, when the baby's newborn, I'm going to have you feed them every 2 hours until they get back to birth weight. And then at that point, it's about every 3 to 4 hours. And by 6 months, mom and dad, even if they don't let you know this, they should be able to sleep through the night at 6 months. So not getting up in the middle of the night and feeding them is okay. So what do I do if my child suffers from indigestion, constipation, or diarrhea? Well, I can tell you, we see many kids with all this. So it does vary age. Pediatrics is all about the age of the child, developmentally, where their guts developed. It all makes a difference, and what all they're experiencing in life, right? So when you're a newborn, whether you're breastfed or bottle-fed formula, that's going to determine some of the indigestion, what they're experiencing. If they have reflux, that's going to play into that as well. So constipation, that really is, sometimes there's a misunderstanding of constipation. It's really the consistency of the stools. Hard stools is constipation, not whether they go every day or not. So it's important that initially when babies are newborns, they're going to probably go every time they feed, and it's going to be what we call CD yellow as breast milk stool. So that's normal. And then that's going to become more solidified the older that they get, and if they're formula fed. So many times, yes, we look at the consistency, and it is important if they go every 2 to 3 days would be good. Some of them do get fussy when that lengthens and they don't go once a week. It's not, we don't call that abnormal. If they only go once or twice a week, that can be normal, but are they fussy? So it's based on their behavior. Indigestion can be caused from the milk, the temperament of the child, to be honest, the environment. What's the environment? Is the environment stress, tense? That can also cause some temperament changes in the baby, which can cause the stomach to be upset. And diarrhea, many times, you have to define that again. Loose stools, that can be caused if you're just starting solids in a baby. At 6 months, we'll start oat cereal. Instead of rice cereal, we do oat cereal now. And that can cause changes in their stools. And some kids, depending on new foods that are added, can get some diarrhea. And older kids, or if the child's in daycare, that can create some diarrhea in the kids as well. So the fourth question is, why does my child suck on their fingers? So I think there's probably many reasons for that. Just a primitive reflex that babies have is to suck. It's a comfort thing. So many times we'll either do a pacifier. Some babies won't take pacifiers, and they gravitate toward their thumbs or fingers. I think I've kind of learned I'd rather have the pacifier, because I've seen kids now that are literally sometimes 5, 6, and 10 that cannot get rid of, you can't cut the thumb off or the fingers, but it is usually a comfort thing. Now, when they're younger, I think we kind of accept that, right? It's a comfort thing. They've got a little blankie. It's to console themselves, to calm themselves. As they get older, though, we do need to get rid of the pacifier, or we need to train them. We need to figure out why they still suck their thumb or fingers. I think sometimes it is an emotional comfort, and how can we help them develop another way of comforting and soothing themselves? Because there are consequences of sucking your fingers and thumbs. It misaligns your teeth. They'll get teased at school. So there are reasons we want to get them out of that habit. It becomes a habit, but it's usually a comfort, a soothing of their emotions is why they do it in older ages. So the fifth question is my baby's heavy breathing at night dangerous? So breathing, there again, with kids, it's always varied on their ages. So newborns, and I'd say, well, most children under 1 year, they breathe faster than adults do. So they breathe, they're going to breathe 30 to 30 times a minute, most babies, 30, 35. So breathing fast, in little babies, they do periodic breathing. So they'll breathe really fast and then they'll calm. Really fast, it's called periodic breathing. That's normal. So breathing heavy or fast at night in a baby that has a cold or sick, that can be signs of pneumonia. So if you're breathing really fast and hard when you don't have fever, you always need to remember, fever makes us breathe fast and hard. That's normal. So I always say, get the fever down, give them Motrin, get the fever down, and then look at their breathing. If they're breathing fast and hard, you're seeing ribs when they breathe. That's called retractions. Those are times you need to see a doctor for that. You need to see a pediatrician, a primary care provider. They need to be seen for that. But periodic breathing is normal in newborns, and that's just where they breathe really fast, and then they kind of slow, then they breathe really fast. Question number 6, are allergies hereditary? So I would say allergies are familial, meaning they run in the family. So just like asthma, you have probably a predisposition to have an asthma if a sibling has asthma or if a parent has asthma. So same with probably seasonal allergies, what you react to in the environment, probably seasonal. I'm really not sure if food allergies would be familial. I think more seasonal allergies would be familial. So question number 7, why is my child not eating much or losing their appetite? So I would say there again, it depends on the age of the child. So young kids, which is kind of funny, they eat when they're hungry. As adults and older people, we tend to learn eating isn't just about giving nutrition to the body or feeling full. We eat because we're bored. We eat because we like it. We eat out of pleasure. Kids eat because they're hungry. And once they're full, they're full. So sometimes they're so busy in activities, they don't think to stop and come eat. or if they snack a lot or they fill up on milk, many times they're not going to eat. And then other reasons kids they go through a picky phase of eating where they don't like the texture, they don't like a particular food, the taste. And I think it's important during those times to keep trying various foods. Some flavors, some tastes, some textures are acquired and they can learn to eat. Now, when that becomes concerning would be if you felt like your child was losing weight. I can tell you in 30 years, I may have admitted one child for not eating. So that's not very common. Usually they're just going through stages of pickiness. But there again, parents, I always say kids are responsible for how much they eat. You're responsible for what they eat. So don't go into the mindset of he'll only eat chicken McNuggets. He'll only eat sweets. I just feel good if he's eaten something. No, stay with eating healthy foods so that you're training their palate to crave the healthy foods. Okay, question 8 is, why doesn't my child speak? So there are several answers for that. I would say there again, depending on the age of the child and the situation. So this is kind of an interesting piece of information is motor skill and verbal are inversely related. So if the child's very active physically, a lot of times their verbal skills are less. So they kind of inversely go. If the child's very verbal, sometimes they're not very active. So those develop at different levels. So different stages. So the other thing you have to think of, I immediately want to look at the pathology first, right? Make sure I'm not missing anything. I check their hearing, make sure they're hearing well, make sure they don't have fluid behind their ears. There's such a spectrum for speech development. 18 months, 15 months, you want to be hearing some words, right? Few words by 2. You can anywhere, the charts will say anywhere from 50 to 200 words, which is a huge span, right, of how many words they should be speaking. But primarily, if your child's not talking, we want to just make sure the hearing's good. So having a good hearing test to make sure they don't have fluid behind their ears from having ear infections, or if they have colds all the time, they can get fluid behind their ears. If they have allergy, mucus all the time, they can get mucus behind their ears. So you want to make sure their hearing is good for the speech. And then sometimes speech, there's several things that can interact with why a child doesn't speak. I actually had one situation that's called mutism, which was interesting. I had a 6-year-old that would not talk at school. She wouldn't talk at school. She wouldn't talk to her teacher. She wouldn't talk to even really her friends at school. She would talk to her mom. Her mom worked in the school, so she would talk to her mom. And then at home, mom would say she's very verbal. But at school, she wouldn't talk to anybody. And even at home, playing outside the house, she wouldn't talk. That's called mutism. Many times they need therapy for that. They need play therapy. And that's what we did. We sent her to play therapy. And I just actually had her come in the other day. And this has probably been actually 6 months, maybe 9 months. And she wanted to have a conversation with me in the appointment. And she was showing me that she's made progress and she can talk to strangers. And mother was affirming, yes, she's getting better at that. So sometimes there is pathology in it and we just need to figure it out. And then we can move forward in that. Question number 9, why is my child so hot-tempered? I would say a lot of evaluation has to happen with that. I always tend, because my passion is mental and emotional health, I tend to look at, is there anything they're afraid of? Is there anything that's creating stress in them that's making them act out in that way? Some of it is temperament, our natural tendency to life, on how we handle stress of life. I mean, kids have stress, right? So it's important to look at, do you see any new situations? A new daycare can cause stress in a child, and they kick and scream. A new baby in the home, a new child in the home. They're feeling like they're not getting enough attention. So I always go behavioral. What's going on? I stay calm. Don't overreact to the kicking, screaming, anger. There again, I try to assess the behavior, evaluate the behavior, Try to get them to talk if they're at an age where they can communicate some. You'll be amazed at how young kids can communicate some of their thinking. Getting them to draw is another way. Maybe sometimes they can express their emotions. But anger many times is something going on emotionally with the child. Okay, question 10, why does my child hit other children? So I do get this frequently, actually, from daycares. I actually had a 3-year-old come in the other day. Actually, her parents came in without her so they could talk about what was going on, but she was kicking and screaming at daycare and hitting others. So some things you can look at is, what is their speech? So her speech is not great. So many times they're frustrated because they can't communicate. Even at home, they get frustrated because they can't communicate. So they hit little Johnny, or they hit his sister, or seems like they're always fighting. But I think they're frustrated because they're not able yet to get across what they want to get across. They're trying to learn to communicate. So it's being patient with them, helping them. I still tell them they're learning what's acceptable at that age if they're hitting. It's not acceptable to hit when you're angry. What you can do is sit on your hands, hold your hands tight, and then think, what do I want to say? Use my words. Use my words. So trying to teach kids in those moments when they're frustrated, because that's what hitting is, they're frustrated. And so helping them understand what they're feeling and talking it through. What are some healthy ways that you can get your point across, get what you need? We all have wants, right? And just hopefully as we get older, we learn how to get our needs met and our wants met through our verbal communication. Kids don't always have that. They haven't developed that skill yet. And so that is many times why they act out in anger and hitting and kicking. And we can help them in that. Okay, I hope you've enjoyed this podcast. It's a little different than what I usually do. This is Behavioral Brilliance, but I wanted to give you some helpful tools and tips for general pediatrics. There again, things our kids do, if they all came with a manual, it would really be nice, wouldn't it? But we can get stressed as parents on these little things. So I wanted to give you some of that to help with your stress. And I hope you enjoyed that. I hope that was helpful for you. And I hope you'll tune in next time. My podcast, I usually cover mental and emotional health for kids, building that parent-child relationship. So valuable. Thanks for tuning in, and I'll see you next week.